You?
Swear I just saw you.
You're back again?
Back for more, baby.
How many problems do you have?
You name it, I got it.
No kidding. All right. Well, we're going to do some cervical traction on you today.
Perfect.
I've set up a few things.
Okay.
I know you changed into an outfit that I have access to your neck.
Mm-hmm.
We're going to do a skin inspection, remove the yin-yings, have the necklace out of the way. Okay.
Hair up.
Hair up, just the way we need it.
Yes.
Okay. This table is stationary, locked in position. We've got our leg stool that we're going to use here in a moment. We've already inserted our cradle. We will have attached the anchor rope, and I've already programmed the settings per our protocol.
Okay.
A couple things we have in place just for clinic hygiene. We wipe our equipment down every day, but individually we're going to just put some clean tissue down on the cradle, the headrest, and then it'll be across your forehead as well. A couple things I did kind of before you came in is I strategically positioned the height of the table for the angle of the traction unit. We're going to use our goniometer. This is going to be the fulcrum parallel with the stationary arm parallel with the table, and then the movable arm is going to be in alignment with this angle. When I did it on this side, we're right at 20 degrees, which is perfect because you seem to have osteoarthritis throughout your whole
seem to
spine.
have everything
Yes.
wrong with me. I don't know what's up.
I know. If I needed us to kind of address that suboccipital area, you were having migraine headaches, you just had some tension up at the C1, C2, AO area, then I would have it at a 0 degree angle, which means I'm going to raise the table up a little higher so that we can go from 20 degree measurement to then be able to go to that 0 degree measurement.
Okay.
If you happened, and hopefully you don't, with all your problems, develop a C5, 6, 7 herniated disc, or very localized in the lower spine area, we would lower the table so that we could get a greater angle of pull with our measurement over here. And so then I'm looking to hit maybe about 25 to 30 degrees.
Gotcha.
Okay.
Okay.
So we definitely have to vet the angle of pull on our table. If you don't mind, come forward. I'm going to turn around. We're going to do a quick, you wore your hair up for me. I can have access to your neck. I've done a skin inspection. Looked at your forehead as well. Quick cap refill that you can feel me palpating you. You feel nice and warm, and I see that our refill is within 3 to 5 seconds, which is normal. We discussed not being claustrophobic because of having to have this apparatus around your neck and forehead. For it to work efficiently, we have to have that counter anchoring, and so that your head just doesn't come forward, okay?
Okay.
We did a pain rating, we did a numbness and tingle rating. You do have peripheralization. We're hoping to get some centralization, which means the numbness and tingles that's currently kind of down into your thumb, hopefully will creep back towards the upper arm and back into the neck. We checked your blood pressure, we're normal today. We also, even though you have osteoarthritis, we're clear that you do not have osteoporosis. You haven't had an acute injury. You don't have an unstable joint, and you're not hypermobile, correct?
Correct.
Awesome. Okay, I think what I'm gonna have you do is I'm gonna have you kind of sit on the table, and then we'll put that leg rest in position in a moment. So go ahead and sit on the table, and I'm gonna kind of guide your neck down into the cradle. And maybe a tiny scoot down. Perfect. And back like so. Okay, and I'm gonna go ahead and put your legs up on the stool. And having you, how's that feel? Great. Yes, neutral spine is fabulous. Highly recommended. We are going to kind of be pulling from the neck end but the fact that we have you in this neutral spine position is gonna take out some of that excessive curvature so that you feel most of the treatment kind of through the cervical spine. Sometimes if those legs are out straight, a patient will complain of feeling a pulling sensation in through the thoracic and sometimes all the way to the tailbone. And so that is so uncomfortable that they don't really tolerate traction. So neutral spine is good to go. I'm gonna put the paper towel across your forehead if you don't mind. You wore your hair up for me so nothing's gonna get caught. When we get to the point that if this works well for you, we may consider a home Saunders traction unit, and then I will teach you how to do all this for yourself.
Okay.
For me today, I'm just gonna make sure this is snug, not tight, and then the cradle's gonna kind of catch the posterior neck, and we're looking to really kind of catch the suboccipital ridge as our anchor point. So I could turn these knobs and just kind of cinch in. Depending on the girth or the size of your neck, we may need the cradle completely wide, or we may need to bring the cradle in so that you just are getting a little neck hug. Should not be tight, but definitely should be snug. Snug but comfortable. We're gonna have a couple safety things. I'm gonna set our treatment timer and wear it, take it with me. So as I buzz around the clinic, I don't forget about you.
Okay.
And it reminds me to come back and check you. So we'll do that in a moment. And then the second thing is there's an automatic cutoff button and a call system. This is that very important red button we would hit if you wanted treatment to absolutely stop at any moment. You have that control. I would encourage that it would be something of significance because if you just have a question or a concern, just hit the call button. And I'll come running, or one of my other staff members will come check, okay? But if you absolutely want it to stop because you're having increased pain, increased numbness, you're lightheaded, you're dizzy, you're seeing spots, you feel like you're wanting to vomit, those are not normal responses. If you start to have symptoms down your other arm, not a normal response, okay? Those would be absolute valid reasons to stop, okay? I'm gonna lay this across your abdomen so that you can reach it, but you also kind of have to make a conscious decision to pick it up and hit it. And then this is just if you have a question or concern. All right. I'm gonna step back for a moment. With all setups, I like to step back so that I'm not looking at you through tunnel vision, and I can kind of take it all in and kind of cross-check my work. Because once we hit start and get the machine going, if something isn't quite right on position, angle, comfort, or I've missed a securement, you're gonna have to stop and reset, and that is gonna buy into your treatment time. Just like why I asked you to go to the bathroom. Worst thing would be we get halfway through and you've got to use the bathroom. We're probably gonna have to conclude the session for the day and reset next time. And that's just because the traction table is only on 30-minute treatment slots. We have one table in the clinic and I wanna get as many treatments as throughout the day.
Gotcha.
Sounds good?
Yes, ma'am.
All right. We will shoot a second video on programming our unit and attaching the rope. But at this point, we would hit start and the traction would pull up towards the head of the bed, and the patient's body weight is what would anchor her on the distal end, which now would create that cervical spine distraction, getting a stretch of the vertebral bodies, getting a stretch of the ligaments, getting a stretch of the musculature, opening and gapping the vertebral body space and unloading the disc, unloading the vertebral body, increasing facet space in case you had impingement, or just simply stretched the muscles. Sounds good?
Sounds like a plan.
All right. Tick tock, timer's up. I'm going to turn off the machine. I'm going to take away my call system. I'm going to ask the patient how they're doing and how they're feeling now that treatment has concluded. I'm going to loosen the cradle. I'm going to go ahead and take her legs down. And then the last thing I'm going to do is undo the head strap, because usually as soon as you take this off, they're going to want to sit up. And this buys us a little time to avoid us of orthostatic hypertension, and also just to let her settle a few minutes so that we don't end up with that rebounding pain. Bringing her down too quickly, getting her up too fast, often is what creates that rebounding pain, which is uncomfortable. So think of like a rubber band. We've stretched these segments, nerves, muscles. If they come together too quickly, or we set you up too quickly and gravity pulls you down, like it will, sometimes it'll flare symptoms and it'll make you kind of ill tolerant to traction, and that defeats our purpose here. Okay, now one of the hardest things is getting up off of traction after you've had it. Sometimes you feel like a bobblehead and your neck is a toothpick, right? Because we've given you a big stretch and it can make you feel weak. So I'm gonna help you sit up. Normally I would tell you to log roll to the side and sit up properly, but unfortunately the way we are, we're gonna kind of sit up like a vampire right out of the coffin.
Gotcha.
Okay? So 2 things. You definitely can kind of help yourself, tighten your belly, and then if you want to kind of support your head and neck as we come up, and then I'm going to kind of come under your shoulders to kind of help set you up and support you as well. Okay? So on the count of 3, and I'll help you here. Ready? 1 and a 2 and a 3. Nice. And you can go ahead and pull your legs over. And this is the moment that if you're going to be lightheaded and dizzy, it's probably now. That would also be very normal for orthostatic hypertension. Just that quick change in position can make your blood pressure drop. It usually stabilizes quickly. If it doesn't, then we will just lay you back down and give you another moment, and then I take your blood pressure.
Okay.
All right. We'll do a quick skin check. Things are looking intact, non-irritated. 3 and 1 is looking pretty normal. No irritation across the forehead. Let's give me a post symptom monitoring. Numbness, tingles, headache. We did it before. We did it right now. But I'd like to know how you feel at dinner tonight, and I'd like to know how you feel in the morning.
Okay.
So we can make a judgment call on our settings and our duration and parameters. And if we need to stay the same, if we need to bring it down, or if we can go ahead and bump you up as we are intended. But that's going to be based on kind of how your symptoms change over the 24-hour window.
Okay.
Sounds good?
Sounds
All
great.
right.
Thank you so much.
Be well, and I hope we see you soon.
That is a strong possibility. Thank you.
Yes, ma'am.